Congratulations on choosing regenerative therapy. Once in the body, the growth factors and cytokines that were a part of your treatment will begin to stop the ongoing destructive changes that have been occurring and start signaling tissue repair. It is important not to add to the inflammatory process during this time. Once in the body, stem cells will start to develop new tissue over the next 6 to 8 months, regenerating damaged tissue such as cartilage, ligaments, and bone. Two key pieces of support at this time will be to minimize inflammation and support regeneration. Let's look at how to minimize inflammation. The first step in minimizing inflammation is to minimize activity for the first 2 weeks after your procedure. This allows the healing process to begin. We recommend light activity only. This consists of your typical daily routines without physical training or activities that add pressure to joints and to soft tissue. At this time, it is also important to minimize inflammatory foods based on the list you were given, which includes gluten. Gluten is a protein found in some grains, especially wheat, and is comprised of proteins called gliadins and glutenins that are found within the wheat molecule. Consuming these triggers an immune response in the body that begins in the gut, which may lead to widespread inflammation throughout the body. It is important to know that this inflammatory process can lead to tissue destruction and can suppress the healing properties of stem cells. The next piece for us to look at is avoiding refined sugar. This oh-so-sweet molecule is a main culprit for the ever-growing inflammatory disease problem in our society today. High blood sugar generates free radical damage that affects many areas in the body, such as our joints, heart, and brain. Eating sugar only adds fuel to the inflammatory fire, suppressing immune function and inhibiting the ability for stem cells to do their best healing and repair. The last category of food we ask you to reduce are nightshade vegetables. This is because nightshades contain several chemical compounds that have been shown to irritate, inflame, and cause further degeneration in joints and other arthritic conditions. In your aftercare packet, you'll find a list of commonly eaten nightshade vegetables. Let's look at supporting regeneration. Over the next few months, it is important that you support stem cells in the regenerative process. You can do this simply by eating whole foods. Certain proteins help stem cells proliferate. Their structure is based on amino acids acquired through nutrition. Polyphenols that are found in rich, colored vegetables and amino acids have been shown in research to be prominent in aiding stem cell therapy. The key thing for you to remember here is that there are certain nutrients that are important and that are required for the body to heal and grow, and there are other foods that can increase the inflammatory process. We want to reduce inflammation and improve healing. A simple plan to get the best of what you need and minimize the foods we suggest avoiding is to simply follow the bulletproof roadmap. This gives a very clear indication of foods that are good for healing and the ones that can inhibit it. The next piece to improving outcomes is your follow-up visits for acupuncture. The pooled results of 15 studies showed significant effects of acupuncture for improving stem cell proliferation when compared to control groups. Even when it comes to organ and neurological systems, acupuncture alone improves stem cell function. Recent studies have demonstrated that treatment with acupuncture combined with stem cell transplantation restored more function than either treatment by itself. The final piece in continuing your progress will be to have a regular exercise routine. We encourage you to add exercise back into your schedule at week 3, then slowly increase your activity level. We do suggest that if a particular movement creates pain or discomfort, then avoid a workout that could cause re-injury until further tissue regeneration has occurred. Remember, joints are supposed to move, and that movement is what keeps joints healthy and moves nutrients into the joint spaces and into the connective tissues. Remember, over the next 6 to 8 months, your body will be working very hard to replace damaged cells with healthy tissue and reduce pain. It's important that you support all that hard work by getting the rest your body needs, give it balanced nutrients, and when the time is right, add back in appropriate physical activity. We look forward to helping you.